Good morning again. This is Kathy Pileggi with Quantum Strategies. Just a couple minutes after 7, we are going to get started. I want to be sensitive to your time as well, and then as others join, I can always revisit any questions. This is my third year doing the benefits enrollment for Piper Olson, so some of you may be aware and used to seeing me, and I come on site. I know this year we don't have that opportunity. So what I want to do today is really run through the whole open enrollment timeline, what has changed this year, anything that's been status quo, give you sort of an overview of your overall health benefits plans. And we're going to go through the agenda first, and then we're going to move through the plans. If at any time you have any questions, just feel free to interject. As I said, I left the chat field open here. If you feel more comfortable putting a question in the chat box, that's fine. But I'd rather make this interactive, so please feel free to interject and say, ask any questions you have. If I'm moving too fast, let me know. If you need me to repeat anything, that's not a problem. And sometimes I may be getting to the question that you have in the next slide, so I'll let you know that as well if we're getting to that information. So I'm going to begin now, and as others join, again, we'll just review what we need to. So again, Piper Olson's Veterinary 2020 Benefits Open Enrollment. So the open enrollment is this week, August 10th through 14th. This is our second teleconference. We had one yesterday. We're having one each day, one day of the week. This is number 2. Benefits are effective, as always, on 9/1. We're going to review today. I'm just going to scroll through this agenda a little bit. We're going to review the medical plan changes. There are very few, but we're going to review them. And there was information sent out to you about the potential of changing from Connecticut to Cigna. However, Piper Olson has decided to stay with Connecticut, so we will be with Connecticut, and we'll just go through whatever few benefit plan changes there are. Dental plan changes, I can tell you right now that the dental plan has stayed the same. You're just moving back to Anthem from Standard. So we'll review that just briefly. Vision plan, there's no changes to the vision plan and no changes to group life this year. We're going to just review again the HSA and HRA contributions, and again, reiterate why this is important and understand what the HSA and HRA are and how you use them. Slight change to the telemedicine this year. Supplemental plans with Colonial, I won't be reviewing them, but I always put them in here because that's with Maria Carrero with Colonial. She'll go through your dental and Colonial plans. She's doing that simultaneously, but we like to put them in this presentation so that you're aware of everything that's available to you from Piper Olson and not leave that out as a side sort of a side field there. We want to make sure you're comprehensive and understand what you have overall from Piper. The goals, as always, right? Every year we say this, but as always, and probably more this year with COVID-19, cost reduction. Piper did a really good job. We have negotiated with all the carriers who quoted this year for Piper and Connecticut in particular, and did a really good job in trying to keep your rates not increasing. So we'll definitely get to that and where you are this year with that, because we know cost was a big concern. Increased use of the HSA and HRA to offset the deductible. We'll just touch on that briefly. There is the introduction of a dependent care FSA this year, which is great, and we'll go through that. As I always say, continue to use those supplemental plans. Meet with Maria. Please understand how those plans can help offset your deductible even further. Our goal is always to help you, educate you on the plans, which benefit is best for you, what plan is best for you at any given time, because every year it can change, or every so many years, depending on your family situation, what plan is best for you can change. Okay, so it's always what's best for you, what fits your needs, and making sure you understand how to use your plans. Okay, that's always been our goal. We say that every year, and we want to continue to enforce that. And then we'll go through what we call our benefits enrollment platform, Quantum Ease, just the enrollment instructions, because we know you don't do this often. You enroll once a year. Some people go onto the platform more often to look at their benefits. We want to reiterate how to do so. Okay, so I'm going to keep moving here. I know that some of these screens I'm going to be increasing and some I'm going to be decreasing as we go through to ensure that you can see everything and understand, because depending on what's on the page, we'll have to magnify some of the pages. But our main point is to get through what is the main difference this year. So this is your current plan 1 with Connecticut, the Flex POS 304515 on the left-hand side here as I'm moving the little hand. This is the renewal plan. The only changes are highlighted in yellow. So you went from a Flex POS to a Choice POS. So same plan, it just went from a Flex National Network to a Choice Network, Regional Network. I will explain that. So the only difference, increased emergency room and urgent care copay. So that went from $150 to $250. $75 for the urgent care went to $90. The diagnostic testing, very small increase here. You'll see that there's a 0 right here, and now there's a $10. Everything else is the same, 45, 75 to 350, 375, excuse me. All that means is you could have gone for a simple diagnostic lab test that would have been $0, and now you're going to get charged $10. I can't say what that test was specifically because it depends on what the diagnostic testing is, but I just know that there'll be at least one person who's probably going to say, hey, I had this test done in the past. I just had it done again this year. Why was I charged? When usually it's 0. So I just wanted to point out that there is a change from a 0 to a 10, but that doesn't mean that anything else like your x-rays and MRIs have changed. They have not. They're still going to fall into that 45 or 75 to 375. That has not changed. Okay, everything else out of network stays the same. As we get down here, do look though to see that your rates have decreased. And I know it's interesting because it's rare any year that we can say your rates have decreased. We've done it a couple times, but it's nice to see that this year in this plan we were able to decrease the rates. That is predominantly due to moving it from a flex to a choice network. Okay, yes, we tweaked a few things here, but the main cost reduction is due to moving it from a flex to a choice. This is your non-HSA plan, so the only plan that does not have an HSA attached to it. So you will see here what your monthly premiums were and now what they are, all reduced across all the coverage levels. Main difference with the flex to choice POS. So you go from a national network to a regional network. Well, your regional network, as you see down here, includes Connecticut, Massachusetts, Rhode Island, and certain counties in New York. In addition to that, Connecticut expanded their choice network even larger. So there's more network providers in it, and they've expanded into New York even further this year. So we looked at everyone who was on this plan last year. There was only about 2 or 3 people who actually used the national network. Everyone on this plan used the choice network providers, even though it was a flex plan. So that was one of the decisions that Piper made. That's one of the reasons Piper made the decision to move from a flex to a choice to help reduce this plan for you, because not everyone was using a national network in this plan. They were using it more like a choice network. There could be one or two people where you had a doctor in that national network who's now not in the choice network under this plan, and you want to stay with this plan. If that is the case, I would ask that you give us a call or you submit a question to the Service Center portal, and one of our team members will get to you to double check that and see if that indeed is the case. We want to make sure that is the case. If not, and be clear about that. But if that's like a 1% chance. If there's anyone who actually falls into this plan where they were with a provider who's now no longer in that network because they moved from flex to choice. Rare, but it can happen. So I just want to put that out there as a caveat. Okay. What Piper also did this year, they kept the employee contribution at 65%. So this employee monthly contribution here accounts for Piper paying 65% of the premium. They increased the employee spouse, employee child, and employee family to 50% this year. So it was 45%, and this year they increased it to 50%. So that also further brought down the premium, okay, and the monthly costs for everyone. Again, these are monthly costs. When you get into the benefits enrollment platform, you're going to see it per pay. You're going to see the cost outlined per pay, okay? This is a plan that still has the HRA. Piper will continue to contribute $200 to the HRA. You will get that right up front at the beginning of September and the first pay in September, okay? There's no HSA with this plan, okay? And as we already went through the network. Embedded deductible. Let me just explain that, and I'd like to take the time to explain it because 2 of the plans here have an embedded deductible and 2 have an aggregate deductible, and they do work differently. So an embedded deductible, I'm going to read it first, and I'm going to go up and explain it, give you an example. So a single member of a family doesn't have to meet the full family deductible for after deductible benefits to kick in. The member's after deductible benefits will kick in as soon as he or she has met the individual deductible, but not the expenses of the family members. So when a member has a healthcare expense, the money he or she pays towards his or her individual deductible is also credited towards the family. The family deductible is met by pooling the individual deductible expenses of several family members, at least 2. So let me just I'll give you an example because I know that can be confusing. Here's the $1,500, $3,000, and again, did not change from last year. You have husband, wife, and child on this plan. So you have family coverage in a sense, or yes, family coverage. The husband incurs $1,500 in expenses. Once the husband hits $1,500, his expenses then will decrease. So there'll be zero after he hits the 1,500. Yes, he's still going to have these copays because that's not subject to deductible. But inpatient, outpatient hospital decreases to zero because he hit his deductible. However, the other family members' expenses don't decrease. They have to hit or make up the 3,000. Spouse and or child have to make up the additional 1,500 for 3,000 before everyone's expenses in the family go down. So individual hits 1,500, that individual's expenses start to decrease. Okay. Once the family meets the total family deductible of 3,000, then the additional family members' expenses will decrease. That's what an embedded deductible means. Okay. And when I get to the aggregate deductible, it'll probably make more sense on what the difference is. Okay. A lot of people like the embedded because what happens in a family sometimes is one person does meet the deductible, but the other two won't even hit the other. But in an aggregate deductible, it's different so that one person doesn't get the advantage of their expenses going down. So in this type of embedded deductible, it does play well for an individual who hits their deductible and the rest of the family doesn't. Okay, so I just want to explain that. If you have questions, because deductibles are, confusing, I ask that you submit a question to the portal and one of our team members will get to you and explain it, one-on-one with you. Okay, because I know it can take sometimes a few explanations to understand it. Okay, we're going to go on to Plan 2. Plan 2, current plan is your current Choice HMO HSA 2000, 4000. Same plan, Choice HMO HSA 2000, 4000. The only change here was out-of-pocket max, went from 35.7 to 4,008. Increase in out-of-pocket max, increase in specialty drug max. So you see everything else here isn't highlighted because it's identical. We get down to here and let me just explain what this means. Your prescription drug, you still have 525.50. 50% to 250, 50% to 350. The increase is in the specialty drug max. So what does that mean? Well, specialty drug is usually an injectable drug, usually. It's usually a little bit more high cost drug. In the past, you would have paid 50% up to 250. Now you could potentially pay 50% up to 350. So yes, if you're on a specialty drug, it is a possibility on this plan that you could be paying more this year on the plan. Possibility. I can never say it's a definite because I don't know what prescription you're on, what have you, but I just want to let you know that it is possible that you'll be paying more out of pocket for a specialty drug. Okay. As we get down to the rates here, you'll see last year's rates, this year's rates, and then the contribution. Yes, this plan did increase a bit in rates. The other plan didn't. We said we left that plan. It actually decreased because we moved it from a flex to a choice network. This one, we're keeping very much status quo as much as possible. There was an increase. However, look at the monthly contributions. Employee only went up about $14. But employee spouse, child, and family went down. And that's because Piper again contributed 50% and not 45%. So they're doing 65 towards employee only, which was consistent with last year. 50% they increased it for spouse, children, and family. So again, while it's a $14 increase on the employee only contribution from last year, it actually decreased on the other three levels. Okay, because you just wanted to point that out. This is your HSA plan. This is your first HSA plan that we're talking about here. Plan number 2, Piper will contribute $400 a year or $100 quarterly towards each employee's HSA. So it'll be a quarterly contribution of $100 deposited into your HSA for $400 total. No HRA with this plan. And again, it is a choice network, same as last year. Emergency care is covered outside of network under the HMO. I just want to be clear of that. Non-emergency care is not covered. So let me just explain that. This is the only plan that's an HMO plan. So you have no out-of-network coverage, okay? Low deductible, 2004, to zero after deductible, that's great. No out-of-network. So all that means is, and this is where the telemedicine is going to come in a little bit and why it's important. And I'll explain that more later, but I want to just highlight the HMO and out-of-network. So again, emergency care is always covered out-of-network. So you go on vacation, you're on this plan, you're in Florida, God forbid something happens, you're going to get covered. You're fine, okay? You're on vacation, you're in Florida, your child gets an ear infection, really hurts really bad. That's not an emergency, but you got to get it taken care of. So you're going to go to anywhere, doctor, minute clinic, wherever you have there, you're going to get it taken care of. You're going to get a prescription, get that taken care of. But that's not an emergency. So you won't pay your HMO rate because you're out of network. You're going to pay whatever the out-of-network fee is, because you don't have out-of-network coverage. So whatever that fee is at that urgent care, at that clinic, at that doctor that you went to, you're just going to pay out of pocket. That doesn't mean it's going to be a lot, but I just want you to be aware that you won't be applying your insurance to it and you're just going to pay out of pocket. Okay, but that's where telemedicine comes in, and I'm going to explain that when we get to telemedicine because it'll make more sense then. So I just wanted to explain that on the HMO plan. Okay, we had quite a few people on this plan last year, but I just want to always make sure you understand the out-of-network, how that applies. Aggregate deductible. What does this mean? And this is for this plan and the next plan. The health plan does not begin paying for the health care expenses of anyone in the family until the entire family deductible has been met. A single member with high expenses or a few family members can meet the deductible, and then after deductible benefits will kick in. So for example, $2,000, $4,000. Same family as I said in the previous example, husband, wife, child. Husband hits the $2,000. You normally say, oh, it's zero after deductible. I now go to my PCP, I hit my $2,000, I shouldn't pay anything. The husbands will still pay something out of pocket until the whole family meets the $4,000. Whether the child or the spouse that makes up the $4,000 or both of them do for the rest of the year. The husband's expenses do not go down until the whole family deductible is met. Okay, so that's a difference from an embedded to an aggregate deductible and the difference between some of your plans, okay? So until the whole family deductible is met, then the expenses of everyone in the family goes down. If you're an individual on this plan, this whole aggregate and embedded deductible doesn't matter to you because you're never going to have the family deductible apply to you. I mention this because there are quite a few families on this, and these are questions that come months later when we get the calls, and people say, I didn't understand the plan worked this way. I just want to make sure it's set up front, and then we can always answer your questions directly. Submit a request through the portal and be happy to give you a call. Okay, so definitely went through this one here. You might be asking this fee at this point. This plan went down, the first plan, this plan went up a little bit, but the Piper contributed a little bit more, so you're not really paying a whole lot more. I just want to stop here and say that Piper did a great job this year at really trying to work with the carriers, and the carriers did a great job as well, and Connecticut did, in trying to work with balancing out your plans. It's rare that any one plan, all plans either increase the same or decrease the same. So it's usual that some plans take a little bit harder hit than others. In other words, some plans will go increase while other plans might decrease. That happens sometimes, some years, and carriers do work with us, and it depends on the number of people. Which plans are getting the most usage sometimes get the bigger increase from the carriers. So this year, the Connecticut definitely worked with us to try to minimize these increases across all 4 of your plans. But obviously, one plan took a little bit more of a hit and increase in premium, and it was this plan. But as I said, Piper contributed more, so it definitely brought down what that increase was this year. So I just wanted to let you know it was a bit of a balancing act in trying to get Connecticut to, balance the increases and decreases across your 4 plans, but did well, and Piper definitely went to bat for you and for the employees to try to get this as close as possible and not have you incur much increased cost. The reason for the increase to 50% in the other coverage levels, so employee only stayed 65, but they increased from 45 to 50 on employee, child, spouse, and family, is because Piper realizes Piper's been open the whole time during COVID as an essential business. Despite the fact that I'm sure employees and workers have been impacted with different schedules, but we also realize your spouses and your families, depending on what their work and their jobs are, may have had to leave their employment or come off their health insurance and go onto Piper's. So Piper realized that more families may need to enroll in Piper's coverage this year, so they wanted to contribute more to that, the other lines of coverage, the spouse, children, and family, to help you out a bit, so it wasn't too much of a hit, and he had a little bit lower rates this year. Okay, so I will go on from there. Again, at any time, just please interject. Your current plan 3 is a Choice POS HSA. Got the little hand up here, 25.5. Choice POS HSA 3.6. Here's the main changes. It went from 25.5 to 3,006. So yes, the individual deductible went up to $500. The family went up $1,000. The out-of-pocket max went up $1,000 on the individual, $2,000 on the family. So increase in deductible, increase in out-of-pocket max. Everything else stays the same, including the RX. The nice thing here, so yes, it is a slight increase in the deductible. Everything else stayed the same almost in rates. If you look at this, it's nominal, minimal impact. $149.93 to $150, almost could say it's no change. And once again, because Piper increased the percentage on these coverage levels of spouse, children, and family, these employee monthly contributions went down. So again, you have a decrease on this plan. Employee only coverage pretty much stayed status quo, 149 to 150. Okay, so we're looking at maybe a minimal nominal increase in employee only coverage. Again, this is an HSA plan, so you get the $400 a year, no HRA. This continues as a choice network. Nothing has changed. Okay, and it's the aggregate deductible like I explained in the prior plan. The two middle plans, Choice POS HSA and Choice HMO HSA, are your aggregate deductibles. Okay, plan number 4. Connecticut Plan 4 was a Flex POS HSA 5,000, 10,000. Flex POS HSA, nothing, no change there. Same plan, 5.5. Slight increase in the out-of-pocket max, 63.50 to 65, 12.7 to 3. What we wanted to do on this plan, and we asked Connecticut, which they were good at doing, was we said, look, this is a high deductible plan, your highest deductible, but yes, it's your lowest cost plan. But for someone to hit 5,000, after 5,000, can they please have $0 from when they go to their primary care specialist? So Connecticut said, not a problem. We can work with you and customize this plan a little bit. And they took out the copays. Because after you hit this, we know that your primary and specialist are probably the first two things that you see more than anything else here. And we wanted to take that down to 0. So everything else, though, with hospitalization stays the same. Everything with ER stays the same. Diagnostic testing, referrals are not required. Increase in the out-of-network deductible on this one. It's rare that anyone goes out of network because this is a Flex POS HSA. Okay, so that impact should be minimal, if any, because with a national network, you should be able to find any doctor in network in this plan. Slight increase here. I won't say slight because it depends on who this impacts, but you do have an increase in the specialty drug max. So what that means, again, the 50% to 250 is 50% to 400 after deductible. So you could potentially be paying a little bit more on a specialty drug. Okay. They're the main changes. You can see your rates here. Slight increase. That was just due to the balancing again of some things went up, some things went down. But again, you have Piper has an employee monthly contribution last year of $133. You went up about $2, $135. And then all the other coverage levels went down once again because Piper's contributing that 50% instead of 45. So very minimal increase on this plan. Yes, we do understand it's a $2 increase on employee only coverage. This is still your lowest cost plan. And all the other coverage levels went down a bit. This is your another HSA plan. So 3 of your plans are HSA. Only the first plan is non-HSA, okay? Flex POS National Network, and this is your largest network. The embedded deductible again. So this is like the first plan. One family member hits the 5,000, their expenses will go down until the other family members meet the 10. So one family member can hit the 5,000 and doesn't have to wait for the family deductible to be met. Same as the first plan, okay? Minimal increase. Overall, I think Piper did a great job this year with getting your rates very much balanced. Decreases where possible. Where it did increase, they gave more for percentage. So I think you're looking good from employee monthly contribution. With rates really overall decreasing, if not with minimal increases on employee-only coverage. Okay. This I'm going to expand. This is very hard to see, but I like to do this. I'm going to expand this, and you won't be able to see all of it, but it's okay. A lot of times what I do is, okay, it's great. We just saw all the differences from last year to this year with the current plans, but here's your 4 plans this year. Some people say, okay, I want to see just my 4 plans. That's great what the differences are, but now I just want to see my 4 plans laid out. This is good if you want to expand it on your own screen when you're reviewing it, or just print it out, but it gives you each plan currently this year, gives you the rates, the employee monthly contribution, just gives a real quick high level of what's, Choice POS regional, very low deductible plan, has copays, no HSA, has the HRA. So it just gives you that high level look across all 4 of your plans and see where you land. It goes from highest plan, as you can see, monthly premium to lowest, okay? I'm going to stop here too and just say something I say every year, which is when you're looking across these plans, there's no good plan or bad plan. You probably heard me say this before if you heard me talk in the past couple of years. Most people go, oh, the 1,500 is your best plan, the 5,000 is your worst, just because of the deductible. That's not true. All the $1,500 plan and the 5,000 deductible plan cover the same thing. When you go to the doctor, you're going to get seen. You're going to be able to go to the doctor you want to go to. You're going to go to a specialist if you need to see a specialist. It's not that you're getting more or less benefits under any of these plans. You're getting hospitalization coverage. What you're getting, though, is you might pay lower deductible, less out of pocket, but you're going to pay a higher premium monthly for this type of plan so that when you go to the doctor, you have less payout. You pay less. This one, when you go to the doctor, you're going to pay a little more. It's obvious. You're going to pay out of pocket more till you hit higher deductibles, but you're going to pay less in a monthly premium. They all cover the same thing. Okay, so I just want to remind people of that. What I would say is if you're single, you have that you know of procedures coming out, any outpatient surgeries coming out, nothing like that. You go once or twice a year, and I know we don't know what's going to happen to us, but you just go for your preventative well visits. Maybe you go once a year for like, an ear infection or something. Going on a high deductible plan sometimes is the way to go. You pay less than your monthly, and then when you go, you're going to pay whatever it is from the doctor. You go for that ear infection, it could be $120. It's not a $30 copay, but that could be once, and that's it. So look at it that way. And what are you going to put out of pocket when you go versus what you're paying monthly, and work that out per year versus I'm going to take the highest cut plan because when I know I go, I'm going to pay less. That's fine too. Some people could have procedures coming up and say, well, I've got the surgery that I have to get done and I want to hit 1,500 and I know it's going to be zero after that. Yeah, I would take this plan too because I don't want to have to hit the 5,000 and then know that I still have more to pay after the 5,000 if I go in the hospital, inpatient or outpatient. So yes, if you've got any hospitalization or procedures, this 5,000 plan is probably not the plan for you this year. You want to look at one of the lower deductible plans, knowing that yes, you're going to pay a little more, but when you go, you'll pay less because you're going to hit your deductible quicker. It's lower, and then it's zero after. Same thing with this one. Deductible's lower, zero after. So you just got to look at what's going on in your family, what works for you, what you might have going on this year, okay? And that's why I always say from year to year, you got to reevaluate. Okay, with that, I'm just going to move on. I'm going to shrink this a little bit, but I just wanted to go over that because every year I sort of say that, and I just want people to understand they all cover the same things. It's just, do you want to pay more out of pocket in a premium, less when you go to the doctor, or vice versa? Okay, so dental, quickly with dental, I'm just going to minimize this a little more just to get that. There we go. So I'm not going to cover anything with dental because Maria Carrera is going to do it, but I include it here because I want you to know it's all part of your benefits package, and you need to see it with everything, with medical, dental, vision, life, etc. Again, you're moving from standard back to Anthem. Everything's the same on your base DMO, your buy-up PPO. As you can see, nothing's changed. I didn't highlight anything because everything's exactly the same, but your monthly premium went down. So what's nice is that you're going from standard back to Anthem. You had them 2 years ago. Your premium did go down. It's about 1%. We know this is a voluntary all-employee paid plan dental, so you're going to get a little bit of a decrease there this year. We put in the link again if you have to now look at going back to Anthem, and I'm not sure if your doctor's from standard is in the Anthem network. Probably is, but want to make sure that you have the little link there to look that up. Again, Maria is reaching out to everyone. If you have not spoken to Maria, you wish to speak to her, please feel free to send us a request in the portal. We'll get your information over to her and she'll reach out to you and her team, okay? And she'll also discuss the Colonial plans. Vision, we're going to just briefly go over vision because the nice thing with vision is no change this year, no change in benefits, no change in rates. You're with IMED. IMED back in March, April, when all this COVID came out, communicated that they were not changing the rates for any of their employers, any of their clients all year. So any client they had, any employer that has coverage with them, IMED committed back in April that no rates would increase throughout 2020, which is great. So no increase in rates, voluntary plan stays the same. I'm going to keep moving on this one, okay? Which is we're very happy about. HSA, HRA, let me just review this briefly to make sure you understand or if you have any questions. HSA, the employer is going to contribute $400 a year, $100 quarterly. Also know that in HSA, you can contribute as well. So an employee can contribute up to a max of $3,550 individual, $7,100 family, okay? HRA is only the employer contribution. Employee can't contribute to that. And on the HRA that applies to the first plan only, that 1,500, 30, 45 plan, employer is going to contribute $200 a year right up front, okay, in September. So the HRA is available to employees on that first plan. The non-HSA, the HSA is available to the employees on the remaining 3 plans. HSA can be used for medical, RX, dental, and vision. HRA can be used for medical and RX. That means prescription only, not dental and vision. Okay. HSA and HRA can be used to meet deductible expenses. That's a given. And you will continue to use your debit card. If you don't have a card, in other words, you are on you're new and didn't have, joining these plans, you will obviously get a new card. If you had a card last year, you're just going to continue on the same card. Okay. HSA is pre-tax. Money in the HSA at the year end is yours and rolls over year to year and can be used for medical expenses. So it doesn't matter whether it's your contributions or the employer's contributions, that's your money to keep. Money in the HRA at the end of the year is the employer's, oops, saw that there, and goes back to the employer. So that HR money, if not used, goes back to the employer. Okay. Employees with money in the current HSA can still use the funds and could transfer to the new HSA. So I'm just going to briefly explain that. If you're coming on from another plan, another employer's plan, you have money in an HSA that you have with the previous employer, you can still use that. You can also transfer that money onto the HSA with Piper Olson if you choose to do so. And we would provide more specifics individually if you had that. Okay. And I do have a question here. How do you find out the balance on your HRA or HSA? Yes. The Harrison Group is our provider who manages it. We have information. I'm going to take down your note right now here, and then I'm going to send you some information there that shows you how to go onto their portal and check your balances. With the HSA and HRA, unfortunately, we're not able to check your balances for you because they are treated like a bank account and the privacy issues. So I'm going to provide you the instructions. I see the question here, so no problem. I'll get that out to you, Marnie, and we'll get you over the instructions on how you can check that out. Not a problem. And any other questions, please feel free to ask or just put it in the chat there, and we'll get the information out to you. I'd like to be able to check it for you, but given that it's confidential, you need to look at your own funds and information and see what's in there and see what your balance is. Dependent care FSA introduction this year. This is new. So this is the ability to pay for daycare costs on a pre-tax basis. Maximum yearly amount allowable for 2020 is $5,000. For individuals or married couples filing jointly, it's $2,500. I'm sorry, it's $5,000 for individuals or married couples filing jointly. $2,500 for married person filing separately. That means if you're married, your spouse has an FSA at their employer, and you have an FSA, then you're held to the $2,500 because together as a spouse you can contribute the $5,000. If you're the only one who carries the FSA for your family, then you have that full $5,000 limit. You select amount at the start of the plan year, and it's prorated and deducted per pay. It can be reimbursed via debit card, or you can submit a manual claim. And from what I understand, you can use the same card if you're having the HSA or the HRA and you choose this dependent care FSA, you're going to be able to use that same card. Okay, everything's going to be loaded on that card. You won't get a different card. If you don't have the HSA or HRA and you choose the FSA, obviously you'll get a new card, or if you're a new employee, you'll get a new card. Amount cannot be changed during the year, and I have a little asterisk, and I'm going to go right down and explain this. So usually in a dependent care FSA, when you choose the amount, you're locked into that amount. So if you chose $4,000, that $4,000 is going to be spread across the year per pay. And whether you use the full $4,000 or not, you're going to be committed to that. Because of COVID in this year and all the issues with daycares closing and not being available and not having family care and everything, the IRS did release a change to FSAs. And this year you can increase, decrease, or stop contributions and then start them up again. So we've had a few other clients with FSAs, dependent care FSAs, who have done that because obviously daycares were closed for a bit and now they're continuing to get money taken out of their pay, but they're not able to use that money. And what happens with the FSA is money not used doesn't roll over. If it's not used, you lose it in a dependent care FSA. Okay, so that's why we always say use it cautiously. Be a little conservative the first year. And this year I know is an iffy year because of everything that's going on, but you want to lowball the first year, see what you use, and then the next year you have a better idea. And this is an exception year, obviously. You can only use the amount that's currently on your debit card and withheld from your pay. Or in other words, you cannot use a full yearly amount up front. So if you choose $4,000 and here comes 6 months later and you've got $2,000 on your card because the year's not end, so you haven't had the full $4,000 deducted from pay yet, but you want to pay that full $4,000, you can't. You have to use whatever's on your card up at that point. So if it's whatever's on your card is what you can get reimbursed. You can't fronted the money ahead of time. Okay. I say that because that's different from how a healthcare FSA works. Some people have a healthcare FSA or may have at another employer and might say, well, mine didn't work the same way. Well, that's a healthcare FSA. You can actually front the money. A dependent care FSA, you cannot. So I just want to make sure that's clear, okay? And Piper's only offering the dependent care FSA, okay? Who's eligible under age 13? A dependent who's under the age of 13, who the employee claims as a dependent or is fully supporting. Can also be a spouse or other tax dependent, or somebody who's physically or mentally incapable of supporting himself or herself and usually lives in your household, or you claim as a tax deduction. It can be an outside dependent care facility like a daycare or a household facility, which allows you, the employee, to be gainfully employed. So if you have a spouse or a grandparent who's actually living with you and you claim as a dependent and they live in your household, but for you to go out to work, someone has to come in for 8 hours or more, or at least, then that's considered a household facility. And that's the dependent care account can be used for that, okay? So I just wanted to clarify that since it's new. Telemedicine, same great benefits, a little bit different flyer this year. We've updated a bit. Here's where the change is. You are eligible for this with Piper Olson this year, even if you don't select Piper's health insurance. Last year, you had to select your health insurance to be eligible. This year, you can choose telemedicine, even if you choose no other health insurance. You don't choose medical, you don't choose dental, you can still choose telemedicine. However, it is now 100% employee paid. So it's gone from being 100% employer paid to 100% employee paid. And it's $12 per employee per month. There wasn't enough high usage on this plan with Piper paying it, and they wanted to focus and put their benefits and the energies on the medical plans and give you more in the medical plans this year. So that's why they did take away paying 100% for the telemedicine plan, but they want to still make it available to you and just make it employee paid. So if you choose to still want it, you can still get it. That's not a problem. Just know that when you go on the enrollment platform, if you had it last year, you just elected it and it was $0. This year, if you just automatically elect it, it's going to be $12. So we just want you to be aware, and that's why we're being very stressing as we go through these communications. Please go on and review your benefits, because you might just say, oh, I have telemedicine, it's okay, I'll just re-enroll in it. We want you to be aware there is a cost now, because a month later when you see it come out of your pay and then we get the call, I didn't realize. We want you to be aware, okay? Still a great program, all the same benefits. And as I mentioned, if you're out of network, like the Choice HMO plan, or anywhere where you're out of town, you're in another state, instead of using your insurance, going to a clinic, pick up the phone, call the doctor. The doctor will tell you, do a FaceTime with the doctor, whether you still need to go see someone or whether they can prescribe for you and send you to the nearest clinic or pharmacy in that state and just pick up the prescription. It's $0 when you make the call. So this is valuable no matter what plan you're on. Also, it comes with an RX card, so you get a little prescription card with the telemedicine program. This is different from and not connected with your Connecticut medical insurance and prescription coverage. This is separate. So you can use this card at any pharmacy anywhere, and they have to give you either the prescription that's lower, whether it's lower on this RX card with telemedicine or it's lower on the Connecticut medical prescription card that you have. So it's always nice to have a secondary form of RX coverage, because you never know where you go and what prescription you might be taking, even if it's a 7-day, step down Z-Pack type thing, that it could be more expensive on your Connecticut health insurance versus on the RX card with telemedicine. It just depends. Okay, so we just want you to know what you have, what's available to you, and use it. Okay. Moving on here, how to find a provider. I'm just going to briefly go through that. You're not changing from Connecticut, but we do know you have in that one network, you went from Flex to Choice. So in case you have any concerns, this is just how to look up a provider under Connecticut. And then also member services. I prefer to call sometimes and go online because I like to talk to someone and give specifics. We're just reiterating your Choice network and your Flex network. This year there was a change. Instead of the PCHS network for Flex, Connecticut moved to the Aetna First National Network. Excellent network, large network, just as good, if not better, and more expansive than the PCHS. So all positives there. All plans provide for emergency care out of state, but then I list where there's slight differences in the plans when it's non-emergency. We put your dental provider and number here and vision just so you have it all in one place, okay? Frequently asked questions. I always just like to go through this because, again, we forget. We go through so much information and we forget some of the basics. Preventative care is covered 100% on all 4 plans. Always, all 4 plans. You go for your yearly physical, yearly basic lab work, preventative $0 covered, okay? Your physical or your mammogram Colonoscopy, what if you have to get it, whatever year that might be, it's once every 3, every 5, whatever. You probably will have to still go to the facility that they tell you have to go to, but that's preventative, okay? If you get a colonoscopy and there's some result that comes back and they say, well, we'd like to see you next year and you need to have it repeated, that next year is not a preventative colonoscopy, okay? That next year is a colonoscopy you're probably going to pay something out of pocket for, okay? So I just want to make sure that's clear because we've had questions about that. Maternity prenatal visits, 100% no charge. Infertility covered under all plans, but you definitely want to call member services, talk to them about the plan you're on and your specific questions on what's covered and how much, okay? Mental health covered on all plans. You do want to check the provider directory on Connecticut to see what are your covered doctors and facilities. You can participate in the HSA if you're on one of the HSA plans. If you're covered under a spouse's insurance and your spouse has an HSA, you cannot contribute to Piper's HSA. If employee has self-only coverage on an HSA plan, but your spouse has family coverage, so you have employee-only coverage and your spouse covers himself and or your kids under his plan, his or her plan, and he has an HSA, he or she has an HSA, both spouses need to stay within the family contribution limit of $7,100. Okay, because you both have HSAs, so you both have to stay within. Your total between both of those HSA accounts can't have to be $7,100. Okay, and again, if you're one of those few people in that situation, you call us directly and we talk it through with you. The funds in your HSA accrue interest. Employees can invest any funds that exceed $2,000. We also supply you the information on how you can do so. You want to reach out to us through the portal again, because that's something we don't want to just put on the benefits platform because it's not a frequent request as well. Again, the contributions for the HSA for individual and family, and always if you're over 55 and over, you can always contribute an extra $1,000. We always ask that you check the provider network directories. Why do we say that? Because every year when there's, open enrollment, here comes 9/1, plans, we say they don't change much. There's, little changes here and there. And then all of a sudden, a month later, someone finds out that their doctor is not in their network or the doctor dropped out of Connecticut's network. That's not just because it was open enrollment or a change in your plan. That's just because the doctor chose, for whatever reason, to either join the network or drop out of the network. And we can't control that. It could be that doctor and that practice doesn't like the amount of reimbursement they're getting from Connecticut, or the Connecticut won't work with them on something, and they just now decide to move in or out. So we can't control that, and that's something that just can happen. Is it infrequent? Yes. But it does happen. And it's not because your plan changed or open enrollment happened. It could be because the practice that you go to decided to make a change with their contract with Connecticut. So I just want to mention that. All these little things that are going on, through the year. If you're waiving coverage, yes, we still ask you to go in and waive your coverage. We will say by the end of this week, if you have not waived and we see that you waived last year, we're going to automatically waive you again. But the reason we do that is because this is your one time of year to go in and see what your benefits are. And just like I said, telemedicine now changed to being employee paid. If we waive you and then you said you didn't know that and you really wanted it, well, we're giving you every opportunity to go on and look at everything that's available to you. Okay, so we want to make sure you're aware before we then waive your coverage for you. Okay, this is your opportunity. So if you have friends, colleagues who haven't signed up yet and they're saying, I always waive coverage, I don't need to, we'll be reaching out to them, those individuals, but you might want to let them know there were some changes. You might want to go on the online platform and look, or you might be able to get telemedicine now because you couldn't last year because you waived. Well, now you can because it's employee paid and it's only $12 a month and you might want to choose it. So things like that. We want employees to be educated. Main changes. So if you said to me, could I summarize the main changes for you this year? Here's what they would be. Increase the employee's spouse, children, and family contribution by Piper to 50% from 45% across all plans. Due to COVID, again, the increase was due to the event of family members needing to move to more coverage with Piper. I'm going to say an approximately $2 to $14 monthly increase in employee-only coverage on 2 plans. Otherwise, all their plans, and that was on employee-only coverage, all their plans and coverage levels either were status quo or decreased. Okay, there was a decrease. And you can see that when you go through the plans and look at the comparisons. Dental rates decreased and you went back to Anthem. Vision rates hold the same. Telemedicine is now voluntary, so it's employee paid and it's not employer paid, but now it's available to all full-time eligible employees. Low usage to date. Piper wants to now change and put the money toward the higher usage benefits, which is your medical plans. They're going to always reevaluate. That doesn't mean next year or 2 years from now, telemedicine might become employer paid again. Okay, they're always reevaluating. And you have the addition of the dependent care FSA. Main changes from Connecticut, and I just want you all to be aware of this. Out of area partner for Flex POS is changed from PHCS to Aetna First. Okay, there should be minimal impact, but you never know, and I want people to be aware of that. You have a larger regional network for the choice plans and extends further into New York, which is great. All members will receive new ID cards and new ID numbers. So even if you stayed on the same plan, we know the Flex POS plan, the first one moved to a choice plan, so everyone will get new cards, but actually everyone's getting new cards this year. Because of the change with these networks and everything, Connecticut decided they're going to reissue new cards to everyone, new ID numbers. Doesn't matter if you say I'm on that same plan, Choice HMO HSA, and I'm moving, and I know that there's a slight change in one of those benefits, but you're going to get a new card. So if anyone has a procedure, any type of appointment in the first 2 weeks of September, we're asking that they send an email to the HR Service Center portal and let us know, because cards will probably not be to you. I'm going to be very honest, and not be to you by September 1st. We're a little tight on enrollment. Some people will have them, some won't. We want to go online with Connecticut, get your ID number, and send it to you via email. So anyone has any appointments between the 1st and 15th of September, we ask that you submit a request to our portal. One of our team members will then get it with Connecticut and get you that ID number via email as soon as possible. And we already have a few people in that situation. I like to communicate that up front so you're aware. Okay. We always seem to be a little tight, so we're used to this. We all should be used to this, but it was great this year that we could take the time to really evaluate what we were doing with the plans, but that also took a little extra time going back and forth with Connecticut, and so we're a little bit later, but we're going to work with you and get you your information as quick as possible. How to enroll? Well, Quantum E is the enrollment. We know that some people go in once a year, some go in more frequent, and we also know you're not going to remember sometimes how to go in and what to do. So here's the link. If you remember, that's great. Go ahead, log in, use your username and password, and enter it. If you forgot your password, you're going to hit select reset forgotten password, and you're going to click the button underneath the employees, okay? And then it's going to send you an email. If you forgot your username, again, we're going to ask you if you forgot your username, because you won't be able to reset the password. You actually forgot your username. Submit a request to the HR Service Center portal. We're going to then send you a reset email. The portal is right here, okay? If you've never registered, you said, I can't get in, I've never registered, here's what you're going to do. You're going to go to that link. You're going to select register as a new user and enter the information below. Company identifiers, POV, last four numbers are your social and your birth date. Once you're in, this is what you'll see. This is, of course, is a mock, but you're going to see this. It's going to say your name here, and then you're going to hit start enrollment. Once you click start enrollment, the open enrollment will appear, and you'll be able to get started, update any personal information, enroll in the medical, vision, HSA, HRA, telemedicine, group life, and FSA. I didn't mention much about the group life. That's because you get automatic $10,000 group life paid for you by the company. That continues. It's the same. You're going to see that in the enrollment platform. You're just going to continue to click it and move on. $0 to you. So when you hit the open enrollment, this is pretty much what it's going to look, and it's going to say get started, and you'll be able to plug away. Again, a reminder, dental and supplemental plans occurring with Maria Carrera at Colonial. She's simultaneously contacting you. That's because she handles those two lines of coverage. But again, we just put the dental in here so you could see the complete package. You will not see dental in the enrollment platform with us. That's because we don't want to confuse you. Maria will send us your enrollments and we'll get them in the platform, but we don't want to confuse you. You enroll in dental and supplemental with her. She connects with us. You enroll in all the other coverages with us, as I listed here: medical, vision, HSA, HRA, telemedicine, group life, and FSA. And then we get together with Maria and make sure we're all in sync. So I just wanted you to be aware of that. Any questions, we always say go to our portal, and it's listed here. The only reason we say that, there's 4 of us on the benefits team. If any of us is out in a meeting, our email gets full. We hate for you to have something sit, but when there's 14 members and something comes into the portal, we can divide and conquer much easier. And then we also can see if there's trends occurring. For instance, a lot of people not being able to get into the tool, what's going on. A lot of the same questions coming up. And then that allows us to get together as a team and say, okay, we've heard this recurring theme now. Let's get an email out to all employees. They can't see this, and I don't understand this, what have you. Let's clarify it even more. So by going to the portal, it allows us as a team to really troubleshoot and help you more efficiently than going to one team member. We also understand that when you go to the portal, you want to hear someone, and you want to talk to someone. That's all you need to say. We don't want to go back and forth via email. We rather pick up the phone with you, but just submit the request, and then we can find the best team member to describe and help you with your situation the best. That's really why we do that. It's not that we don't want you to send directly to people's emails. It's just actually more efficient to go to the portal, and then we can divide and conquer. I think that's it. I know it was a lot of information. I'm just going to go back up to the front here. A lot of information. This material is on the benefits enrollment platform. It's under documents, under compliance. So when you're on your home page, you should see under your compliance documents. If you don't, please submit a request to the portal and we will shoot this out to you. We'll just attach it right in a response right back to you. You'll get this document attached to you. We're in the process of updating the benefits guide. We're a little bit tight, so we wanted to get this material out to you first, and the benefits guide will be updated as well. I know it's a lot of information. Feel free, if you have questions, we can set up one-on-ones. We can walk you through or enroll links. I know some people just like to walk through it over the phone and we hit the buttons for you. That's fine, we get it. If that's what gets it done, we're happy to do that. But any questions at any time, submit to the portal and one of us will definitely get back to you. So I will pause. I know we just came under that. We have 8 minutes left. I want to be sensitive to your time, give your time back to you. But if anyone has any further questions, I'll just pause for a minute. Okay, then what I'll do is, and I know that you can reach out to any of us. I'm going to end this teleconference. I thank everyone very much. Appreciate all your time. Again, we'll have another one tomorrow at 6 o'clock at night, and then Thursday and Friday, one at 12 noon on both Thursday and Friday. We kept them more to the midday towards the end of the week, but you can always reach out if you just want to talk to us individually. If any colleagues of yours say that they can't attend the teleconferences, just tell them to reach out to the Service Center portal, say that they want a one-on-one, and we'll set that up. Thank you so much. Really appreciate. I know it's a lot of information, but want to make sure you have as much as possible to be able to make the best choices for yourself. Everyone have a great day. Bye-bye.